Welcome, friends. We are revising homeopathic remedy Spongia tosta. And let us again remind so it gets embedded in our subconscious mind. Its common name is roasted sponge and it belongs to animal kingdom. Its family is Colenterata. Remedy was proved by Dr. Honeyman. Here we are dealing with part 3A quick recall. And I would like to remind that this quick recall section, we are streamlining Spongia's most decisive characteristics. Everything a clinician must remember at a glance, or you can say it is a concise, power packed overview to help you retain remedy's signature traits instantly. Friends, the text is taken up from Allen's keynote. And again, this is an academic activity we are dealing with. So it is best for BHMS students, interns, house physicians, and ultimately practitioners at large who would like to recall their materia medica frequently. And this is a condensed materia medica from Ellen's keynote. I am Dr. V.K. Chauhan. So, friends, let us go to the constitutional characteristics. Somatically, physically, best suited to the persons of light hair, lacks fiber, fair complexion. Thermally, patient is chilly 2 plus and side affinity is right-sided medicine. From psyche point of view, you will find the temperament is anxious type. Mentally, patient startles from sleep, weeping, having fear of death, and sadness. Dreams, anxious dreams of fire, dreams of misfortune, dreams of murder, and visionary dreams are there. And desire, he desires alcohol, 1 plus, cold drinks, 1 plus, delicacies is 2 plus. Aversion to beer and food aggravates is fat and milk. You will see all this information is not available with Ellen's keynote, but however, we have supplemented it from Rivers Kent repertory. So it is a very authentic information you are getting. From causation, the diathesis part tells us that this is the best medicine where you will find diseases of children and females. Particularly, if you talk about diathesis, it is having tubercular diathesis or pseudosora ailments from. Maltreated gonorrhea is very, very important, and there is aggravation from tobacco. General characteristics, they include swelling and induration of glands, and especially thyroid gland in terms of goiter, currently we call it. Testicles are swollen, bruised after suppressed gonorrhea. Spermatic cord is also swollen along with orchitis. There is suffocative spells as if breathing through a sponge. Cough is dry, sibilant, wheezing, worse by cold drinks, dry cold wind, reading, singing, talking, and better by warm drinks. Friends, we have again a respiratory important symptom croup. With croup, child is anxious, having wheezing, worse inspiration, and before midnight. Angina pectoris, we have contracting pains, suffocation, anxiety, and sweat, which is worse after midnight. cough and croup is before midnight. The cardiac component angina is after midnight. Palpitations are there, awkward suddenly after midnight with suffocation and great anxiety. Valvular insufficiency. There is a regurgitation. It can be a aortic regurgitation, mitral regurgitation, pulmonary valve has regurgitation, or tricuspid valve regurgitation. So it is a rheumatic valvular heart disease which usually affects the females most. Please, one has to remember this fact. And the symptoms are worse before and during menses. That distinctly tells us the gender predisposition of this particular remedy. Relationship you will find follows well after aconite, hyper in cough and croup when dryness prevails, and after spongia, hyper self when mucus commences to rattle. Spongia is stage is over, hyper self stage comes next. Let us compare arnica, causticum, iodium, lecasis, nux moschata. Here sputa loosened but must be swallowed again. General modalities. We find worse on ascending and before midnight, especially in cases of respiratory problem, and after midnight you can say for cardiovascular problems. Descending and lying with the head low, patient feels better. Let us go to the miasm, and it is a mixed miasmatic remedy having predominance of pseudosora. From posology point of view, you will find the doses in the 6 to 200 potency are best. Repetition, it wears the repetition well, and the duration of action is 20 to 30 days. Friends, clinically, you will find this is most suitable for goiter, arthritis, heart troubles, valvular heart disease, asthma, croup, aphonia, and this aphonia is tubercular aphonia. Yeah, you can say tubercular laryngitis. So, friends, thank you. Thank you very much for your patient listening. But in the end, I would like to tell you that this completes the quick recall of Spongia tosta, a impact yet comprehensive. It is a compact yet comprehensive reminder of this constitutional, causative, and clinical essence. So, friends, thanks once again for your patient listening and for watching. Please remember, sharing is caring.